Week is what is known as International Co-Responder and Crisis Responder Week. It brings awareness to mental health professionals who help law enforcement de-escalate situations where behavioral health is a factor. Tyrah's down in the ARC Lounge right now with Susie Kroll. She's a Therapeutic Response Unit Manager in King County, and Deputy Alex Thomas from the King County Sheriff's Office. Tyrah, take it away.
Thank you, Kelly. And Susie and Deputy Thomas, thank you so much for coming on the show and talking about this today.
Of course, good morning.
I think it's important that people know about this, right? So first off, and Susie, I'll start with you. For people who are not familiar, what exactly is a therapeutic response unit? What do you all do?
Absolutely. So the Therapeutic Response Unit is a unit specialty designed to have mental health professionals partner with deputies to go to calls for service that have a behavioral health, social services need, or a substance concern, so that when law enforcement makes contact with an individual experiencing some sort of crisis, that we can have both sets of skills available to them to help provide resources and de-escalation.
So talk about those skills, your background. What exactly led up to you being in this current position, and why did those skills you have, why are they such an asset to this role?
Absolutely. I have a master's degree in counseling psychology.
Wow.
And it allows me to be a licensed mental health counselor in the state of Washington. And that behavioral health background led me, actually by accident, to crisis work. And back in 2016, started co-responding with law enforcement. And the Sheriff's Office decided to expand that program to the entire agency. So here we are.
That's incredible. I love that. So yeah, I mean, you studied this in schools. It all plays into what you do. So I kind of want to talk about the partnership between the two. So this unit was formed in 2023. Deputy Thomas, can you describe what a typical call between the Sheriff's Office looks like and this particular unit?
I'll say one of the unique things with our program with the Therapeutic Response Unit is that my mental health professional is riding in my passenger seat. We are together in the car the entire time. A typical day on the street is any number of things. You never have something consistent. But a good example of one of the things that we do is we are working emphasis patrol. We're out, my mental health professional and I, Susie and I, were out in SeaTac, and we heard a robbery go off at a convenience store at a gas station. We responded to the scene. My partners who were working the area at the time, they're handling scene security, they're doing the primary investigation, and then as things start to settle down, the scene is safe, we know the suspects are gone or they're in custody and in control, then Susie and I can step in and we had the opportunity to speak with some of the witnesses and some of the victims that were involved because they were very elevated. They were a little scared, they were a little worked up about the incident because it is natural to respond that way to a robbery. But she had a chance to speak with them, help calm them down a little bit, work through some of the situation and process some of the things, and make some connections for a little bit of follow-on care for themselves to make sure they don't have nightmares or different things come up after the incident.
What's that feedback been like for those people you do speak to? I imagine they're grateful for that interaction, or like you said, it calms them, it's calming for them?
It was fantastic. They all felt much more relieved having the chance to speak with her. The clerk in particular, she had been robbed twice before and never had the opportunity to speak with anybody about it. So we told her as we were working through the scene that we were not going to leave without talking to her, and we could see her kind of work through some of her emotions in it. And it's really started to bring her down and calm her down and help her process what had happened.
That's so powerful. And Susie, why don't you just weigh in on why that behavioral health background is needed when it comes to a situation like that, like talking to someone who is in distress?
Absolutely. There's a couple factors that come into play. Normally, I'm listening to conversations about law enforcement things, legal terms, and in an emergency, a lot of those words don't make sense, or we make sense of them because of what we know from watching TV or media exposure. Plus a crisis with heightened emotions, and if it's impacted by a behavioral health concern, symptomology that's elevated because of that crisis, then communication actually gets very difficult. And our role is to not only manage the safety components that my partner does, but to also try and reduce those trauma hallmarks. That clerk that Deputy Thomas is speaking about had been held up 2 times, and she carried some pretty significant trauma, and so her response was, very, very much, I'm glad you're here. Where were you last time? And we did some follow-up care to make sure that she got some service connections.
I'm glad the feedback has been good. Deputy Thomas, you mentioned you try to wait to kind of intervene until things are safe and calm. Unfortunate reality is sometimes it doesn't always happen and things could get violent. What's the protocol when things get like that?
So as ever coming into a scene, if it starts off calm, then we can kind of come in as available. If it changes into a scene of violence, or we have an active threat, or there's a concern for somebody's safety, we co-train with our mental health professional co-responders. So they know to recognize when a scene gets bad, we make a plan before we go into the building. It's going to be moving behind cover or moving out of the building, getting back to the car. We establish those plans before we go into an area. That's always a conversation that we have as we're arriving on a scene. Hey, if this goes south, we're going to go here, we're going to go there. And we train with them together, we work through some scenarios so everybody has a good understanding of how we're going to operate, and they know how they can respond and work with us to collaborate with that.
Safety is priority.
Yes.
So for those who maybe just graduated or so, with a similar background as you, Susie, maybe, you know, really wanting to help people and do this kind of work, I understand your team is looking to grow. What are the qualifications? What do people need to know if they're interested?
Absolutely. For our co-response programs, we look for master's level clinicians.
Okay.
They need a master's degree in counseling psychology, social work, or a related field. And then they have to just have an interest in doing this level of work. We will provide all the skill sets and the training and the necessary partnership trainings, and we look for those qualified clinicians that have that background to bring the behavioral health expertise.
Amazing. And fill me in. You mentioned that you two are riding together on these calls. Every deputy is partnered with someone from that team, or how does that sort of get divided and conquered?
Not quite. So there's a small cadre of us within the sheriff's office that are interested in doing this co-response model.
I see.
So for those deputies to participate in the program, they have to go through a litany of training to kind of have that co-response with us. So they have to be familiar with how the mental health professionals are going to respond, and then we all have to train together. So we have that understanding, that mutual agreement of this is what's going to happen, this is what we need to do, so we can better support each other.
Yeah, the cohesive training. Well, thank you so much for sharing this information. It's certainly needed. I love how you're able to meet people at these scenes and sort of a common ground and try to de-escalate as much as you can.
Yeah.
Thank you so much.
Thank you for having us.
Quite fascinating, right?
Oh my gosh, it definitely is. And you know, such amazing people who do such great work. Thank you all so much. We've added more information to King County's Therapeutic Response Unit at KOMOnews.com/hotlinks. Still ahead, the Storm are fighting to keep their spot in the postseason alive.